Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter G. Today I'm just going to talk about a group of disease associated with the glucose level in the blood, which medical term is called glycemia. This glycemia could be associated with hypo, or euglycemia. It's just the increased glucose in the blood or decreased glucose in the blood, or normal glucose in the blood. So is there any conditions associated with this glycemia in hyper or hypo warrant emergency visit? Yes, both of them. If the glucose is too high, cause the either from type 1 or type 2 diabetes, cause the ketoacidosis and coma, or hyperosmotic coma, which is the glucose very high, above 500. So that's the emergency. People lost consciousness, and also it's very dangerous for all the organs. So that is one of the signs, or one of the serious problem warrant emergency visit. On the other hand, hypoglycemia, lower than 60 or lower than 50, that's also very dangerous. Could be because we all know the brain requires glucose, the only energy resource. So brain can only use glucose as energy. So if the glucose is too high, then really can cause, if it lasts long, can cause damage to the nerve cells, to the brain. So it is also can cause the coma. So that's another sign. Feel shaking, and at the beginning probably feel shaking. If not corrected with some juice or some sugar, probably can develop coma. So these are the conditions associated with either too high or too low glucose in the blood. The euglycemia, before I talk that, just briefly review the hyperglycemia and hypoglycemia. What are the causes? For the hyperglycemia, we know it's diabetes, right? I already talked, if you follow my other videos, there are type 1, type 2 diabetes. The type 1 because the pancreas cannot synthesize or increase or release insulin. So then the glucose circulating the blood cannot be taken by the muscle or by the liver to synthesize the glycogen for storage. So then circulating the blood, and also beyond the kidney reabsorption, so then the glucose also in the urine can have the elevate for the test to diagnose whether the glucose is higher or low. So this is a hyperglycemia. For the type 1, type 2, we already talked about this, and also the complications for this hypoglycemia I also mentioned previously, because the glucose increased the viscosity in the blood and bind with the protein to clot the small micro vessels and cause the microemboli to damage the end organ, either kidney or nerve, around the nerves, or the eyes, retina. So it's very serious. It's a long-term complication. Can be very dangerous, very serious, and some of them are irreversible. So that's the hypoglycemia. And what are the conditions can cause hypoglycemia? Usually the hypoglycemia is caused by the medication, actually. It's because overdose, or the schedule, especially at the beginning after patient diagnosed as diabetes, and usually gradually to decrease the glucose, but sometimes on the people had adjusted dose or lifestyle modification without adjusting medication, so then it can cause the hypoglycemia, so decrease the glucose in the blood. It's very dangerous. It's patient feels shaking and lost the strength, and eventually, if not treated, will faint and coma. The other important concept I like to talk is the euglycemia. Euglycemia, which is good, which means the glucose is normal, in normal range in healthy people. However, in those diabetic patient, this euglycemia could be doesn't mean it's normal, doesn't mean it's corrected, because the follow-up for the management for diabetes, usually the hemoglobin, HbA1c. So this is the monitoring of how diabetes is managed. If only follow the glucose is not accurate, and also it's a sign or easy to mask the truth, the severity of the disease, because HbA1c might be elevated. So that's and the glucose is normal, which is very dangerous. That's the problem. So so for those who have been diagnosed as diabetes, follow up the lab, not just based on the number you check at home. You checked all your glucose is good. It's good. It's just the part of the good. The other part of the good is the HbA1c has to be followed and decrease in the normal range or approaching normal range. So that's two streams and have to be monitored and to manage diabetes. So this is the important information I think need to for this video, because I have talked about diabetes, I have talked about the glucose metabolism, I have talked about the different videos about the glucose and diabetes, but I just want to use this glycemia video to talk about the euglycemia. So do not be confused or fooled by this euglycemia, and make sure to monitor the other value, HbA1c. Make sure it is decreased, in the trend of decreasing and approaching normal. I'm going to stop here. I hope it helps, and thank you for watching. I will see you next time.